So I think we're all familiar with the challenges of SCS, right? The issues that we face. We see patients who have tolerance or loss of efficacy. We know that, there's a significantly high explant rate. Recent literature that's been published has been highlighting this, anywhere as high as 30 to 40%. And we know there are virtual explants. There are patients who have devices that have not yet been removed but are not using them. Revision rates are significant, as high as 15 to 20% in some literature. There are patients who come to our offices and say they have incomplete pain relief and that they have unwanted stimulation and sensations that, they don't care for. And then those who have rechargeable systems, historically, the challenge in, either to actually recharge the device or just the hassle of having to recharge it.